Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and the revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm talking to Dr. Anthony Chang, a friend, colleague, pediatric cardiologist, founder of the Artificial Intelligence in Medicine group that has really exploded onto the scene, and also the medical director for MI3, the Medical Intelligence and Innovation Institute. Anthony, thanks very much for joining me today. It's great to have you on the show.
Thank you for inviting me, Nick.
So I wanted to start off a little bit just for people to get a sense of you. You're really a very accomplished individual. You've done some astounding things, and obviously with real presence in the space of cardiology. Can you share a little bit about your journey of how you got there and what it took to get to the place that you're at right now?
Well, I have always wanted to be a pediatric cardiologist since I was 16 years of age, and after abandoning my initial plan to be an architect. So I was always a builder, always wanted to build things, and I think it's ironic that I am using the realm of artificial intelligence to build again. So I think as we understand data science now, I think it's important for clinicians as a whole to appreciate and embrace this amazing new paradigm without hyping it, of course, but understand the paradigm so that we can utilize so many of the important tools now for improving healthcare and medicine.
So it's interesting, you talk about that, and obviously you've created this whole institute around artificial intelligence. What got you on that pathway? I mean, that wasn't part of your world when you started out, do you think?
Well, I had always been interested in data science. When the supercomputer Watson beat the human contestants on February 14, 2011 was sort of a personal epiphany for me that artificial intelligence was really substantive and robust, and that we need to, and I think some clinicians realized that too at the time, to capture this new resource and create new ways of looking at medicine. So I decided to get more education. I felt like I knew data reasonably well, having been an investigator in cardiology and dealing with data and statistics. I even teach statistics, but I realized that the data science has progressed to the point of basically being a whole new discipline. And I applied for and was very fortunate to be accepted to the Stanford School of Medicine's program in biomedical data science, and focus also on a few artificial intelligence courses during the elective times. So overall, 4 long years, probably according to my mentors at Stanford, graduated with a appreciation and a continual, I think, yearn to learn about data science and how it can be applied in medicine. And yet I felt like very few clinicians had this education or appreciation for the new data science, and wanted to create a sanctuary for clinicians and data scientists and other stakeholders in this area, healthcare administrators, healthcare thought leaders, investors, and very importantly, patients and families, to be part of this ecosystem to push the agenda to understand this new paradigm in healthcare and medicine.
So it's interesting you mentioned the Watson story. I too remember vividly the instance of that. In fact, I had the opportunity to see it before it was published. We had a relationship with IBM at the time when I was working at Nuance, and I had exactly the same reaction. This was revolutionary, and it really sort of felt like there was an inflection point in the innovation that moved. And I think that's one of the triggers. It's the things that kick us into this, wow, this has really moved into a new domain. So as you emerge from that, you obviously, you've created a cadre, and now it's a large cadre of clinicians, and your desire is to really get the clinical team involved. One of the things that I've heard several times, not just from you, but from the people that you assemble together in some of the conferences, is the need for clinicians to do some of the things that you've done, which is to really understand this space. How do you think that folks can do that? I mean, we can't all go to Stanford and spend 4 years studying biomedical science. How do we step up that ladder to really gain the value from this opportunity?
Well, I think it's going to take a subgroup of clinicians within each subspecialty to learn about basic aspects of data science and artificial intelligence, and perhaps help define a list of use cases within that subspecialty, and have them perhaps present those to the subspecialty at the subspecialty meetings or in different hospitals to, I think, take advantage of this new paradigm. And I think it's going to take a few champions within each subspecialty, as well as domains like population health and different other domains, to really create a movement. And I think we're reaching a tipping point in which we're starting to see at least one representative within each subspecialty who are either very passionate about this or now extremely curious enough to go back to school like I did, or at least work much closer with data scientists. And it's going to be, I think, a very, very exciting decade coming up when we see the seeds of all of these preliminary work blossom into very, very meaningful projects. And ironically, just before I came on to your interview, Nick, we sat with a group of data scientists from a local university. We're doing a project in cardiology, and it was, I think, very useful for all of us to sit down together and discuss the nuances, rather than have the data scientists work on a project, present the results to the clinician. I feel like there's so many nuances in biomedicine that are not discussed or implemented into the data science part. And I always stress how important it is to actually do these projects, hand in hand. And I don't think you need to have a data science education to make impact. I think it's more important that the data scientists have access to the clinicians to understand the nuances in biomedicine.
So it's interesting, you highlight a theme that I've heard repeatedly on this show with other people in other sort of focuses, and it's a term that I like to use. I know I'm borrowing, and I would attribute it if I could remember where I first heard it, adjacent possible. And the adjacency in this instance is bringing those folks together. In one instance, it was just co-location of people from other areas in the same facility with the clinical team. And it sounds like, if I'm hearing you correctly, very similar sort of experience in artificial intelligence and data processing is to bring these folks together from very diverse backgrounds, but have them co-located so that they can share experiences, understanding.
Well, you and I like C words, apparently. So my words for this process is, as you recall from the meeting, is convergence. Convergence of clinical medicine and data science, as well as, data science is not just one area. It's sort of perhaps a dozen different disciplines that includes artificial intelligence, deep learning, cognitive computing, et cetera. So just like there are subspecialties within clinical medicine, there are subspecialists within data science as well. And then eventually what I would hope that we start seeing is something that I learned from my computer science colleagues, is convolution, which is a whole new function that comes from two functions merging together. So you essentially look at, I think, biomedicine and data science with a totally different lens that a clinician alone or a data scientist alone will not be able to see. So hopefully more and more people will be wearing this new lens to see, the amazing opportunities that really lie dormant in biomedicine. And when I say biomedicine, I don't mean just clinical projects. I also include how many ways we can actually help fix the healthcare system, including relieving the clinicians of their tremendous burden right now that's creating a lot of burnout. And that's something that has come out in the last 6 months for me is the number of clinicians are really unhappy with the amount of burden and that don't amount to helping patients, and we can change that. I think with smart use of the tools we have within artificial intelligence.
Yeah, that's very much a hot topic, that whole clinical burnout and the challenge of technology and what it's imposed in terms of the individual clinician. It didn't add value, it actually detracted from the clinical relationship. So I'm excited about that.
Nick, I think we use, if I could just interject and say, oftentimes technology is sort of represented by the robot, by something cold and hard and get in the way of patient to clinician relationship. I look at the opposite. I think we can actually enable AI technology to for us to have a renaissance in the patient-clinician relationship by using these tools to bring back the eye-to-eye contact, the reassurance that clinicians are very good usually at to relieve the stress of the patient and the family. So I think if we do this right, we can really bring back the reason a lot of clinicians went into medicine, which is to make impact and reassure patients and families.
Absolutely. I mean, I think I'm in violent agreement, and I often quote Michael Dell, who says technology has always been about enabling human potential, and it is the demand of this new age of clinicians, data scientists, and all the IT people to return us to that facet and opportunity that says we don't get in the way. In fact, in many instances, I see it sort of disappearing into the background. It sort of blends in. We shouldn't even be aware of it. So I'm excited.
I think the nice thing about AI Med that you've been part of, Nick, is we're trying to create a easier route to understanding data science than going back to school for 4 years and learn how to program and learn how to all the complicated issues of data science. So I think coming to AI Med, one gets a very quick orientation to data science and what it can do, and talk to people that are at the top of their field and really understand the capabilities. And I've had senior physicians that came last year and said they never knew most of this world even existed, and these are very accomplished academic clinicians that I think some of whom you've met just weren't aware all this paradigm was shifting so quickly in medicine, because they're in an academic center usually and surrounded by people that may or may not appreciate the new paradigm shift and still count on randomized controlled trials to get us to the next century. In fact, that's perhaps starting to feel a little outdated right now. So I think the exciting thing about AI Med is it's an ecosystem, a sanctuary for clinicians. Just spend 3 days, take a pause from their normal clinical lives, and just learn about this amazing new paradigm shift in a very efficient, productive meeting that's very fast-paced and, as you know, very interactive. And lots of people have lots of good questions throughout. So I think it's I wanted to create that environment for clinicians, that it's not the typical, parade of PowerPoint presentations, but rather a lot of smart people coming together and try to share what they know.
Yeah, so for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Dr. Anthony Chang, founder of the Artificial Intelligence in Medicine conference, and also the medical director for MI3. And we were just talking about that conference, and I personally have had the privilege of attending. I would absolutely concur. That experience is, as I said the first time, very unique in terms of the way that it's constructed. I think you and the team do this really outstanding job of assembling a very diverse group, not just clinical professionals, but data and all the surrounding sort of technologies that play into this, in a format that I was very excited about, specifically the blending of both presentation and discussion. And I want to say still to this day, revolutionary, sadly, it was the inclusion of patients. I think every time I've been, you bring patients onto the stage. We had just the most delightful, compelling presentation from a young pediatric patient and their parents. It was just really, it brings everything back to the consensus of what we're all striving for. So huge kudos, and I think, you know, shout out to that.
I think you're too humble. You're too humble to say that. We actually invited you as a speaker both years, and you were very memorable as a speaker who obviously has spent most of his career in data and data science. And I think inside very happy that we have a new way of doing things. And I think one of the best things about the meeting also is, you know, it's international, right? So you have a ER physician from Australia who dabbled in data science on the same panel as one of the gurus in deep learning from Silicon Valley. And yet on the other side of the panel, there's a parent who's dealing with a daughter with, you know, a chronic disease. So it's just amazing to see the alchemy of all of these different representatives of different sectors. So it's multidisciplinary, multidimensional. We just don't talk about deep learning like a lot of meetings now. We look ahead and think about, is augmented reality going to be a useful tool? Is cloud embedded AI reality for future of medicine? Is Internet of Everything and Internet of Things going to make a contribution? So it's, I always say it's not just about deep learning. So that makes the meeting even more, I think, wide-ranging in terms of topics that we cover.
Right. So as you emerged, you came out of the four-year program. I know you've had lots of experiences, but it would be helpful to the listeners to hear some of the value propositions, some of maybe small improvements or maybe big improvements that you've had the opportunity to be part of as a result of this journey that you've been on. And I imagine focused in pediatric cardiology, but given your expansive sort of relationships, perhaps there are other areas that you can share of those positive value contributions.
Well, I think it's interesting how many ideas you can have about how to improve medicine once you have a pair of different lenses that you're used to having. One of my comments to my program director, Dr. Altman, upon my graduation was, it actually changed how I think about medicine, not just using data science in practice, but I think as a seasoned clinician, and I think most seasoned clinicians would agree that you sometimes go very quickly in terms of coming to a conclusion, and because you've seen so many cases and you've gone through the thinking process so many times, you short circuit your thinking process when in fact, as you know, a data scientist would pump on the brakes and pause and think about things with more objective data. So I'm not saying the clinicians are always wrong by using the limbic system very often, but it's actually good to use both the limbic system and the frontal lobe for as many cases as possible. And I found a couple of cases that I had already made up my mind about a diagnosis and then said, wait a minute, something here makes me think that I should relook at this, either something mundane like getting another EKG just to get more data, which sometimes I think it's probably rare that I did that before the data science education. And sure enough, a patient slipped into SVT or supraventricular tachycardia while she was in the office. And I just find that amazing that I actually think differently as a seasoned clinician and not just about data science. So I think some of the other aspects of this is trying not to also automatically think deep learning and medical imaging or decision support is all there is to using artificial intelligence, and something as basic as, you know, robotic process automation or RPA can do lots of things much better, much faster, less costly for a hospital, both on the administrative side and on the clinical side. So something like RPA can make a contribution in terms of looking at automating processes that humans are doing, like validating insurance or validating information. And on the other hand, that same RPA process can be used for something like automatically selecting patients that should get a RSV vaccination, for instance, that people struggle with all the time. So I think we try to learn to use artificial intelligence in its many forms in different situations and not just focus on, I feel like most of the world is focused on medical imaging and deep learning, which I think is a important aspect, but should not be the only or the most important aspect.
So one of the things that I hear repeatedly, and you and I are both clearly passionate supporters, see the value, but there's a big concern. What's my value in all of this? How do I sort of address the replacement challenge? Am I still relevant as a clinician if suddenly there's all this intelligence and automation and so forth? How do you answer that?
Well, I usually answer in several forms. One is the amount of work, medical images or decision support or lab data is just exponentially increasing. So human beings are not going to be able to sustain that amount of work without any machine-related intelligence. So one, the amount of work is exponentially increasing, so we're not training exponentially more clinicians, so we need to really make up that differential with machine intelligence. Second, I think it's going to make the clinicians' work more interesting, because rather than, I'm fine not reading another normal EKG or normal echo, like I did this morning so many times. I think it would be more important for the basic levels of normal testing to be handled efficiently and quickly by computer vision or computer analytics, and let the clinician build on that, sort of first level of interpretation by looking at things more differently or looking at more esoteric cases with a little bit more time, because we're always rushed for time in the clinic, and would be more, I think, better use of the clinician's training to spend more time on the more difficult cases so that the normal EKG and normal echo doesn't really take up a significant percentage of time. So I think, and then third form to this answer is I like a comment that someone made recently, that a clinician who knows about, in this case, he mentioned robots, but I think it can be applied to artificial intelligence too. A clinician who knows about, let's say, artificial intelligence may replace a clinician that doesn't know about artificial intelligence. So I think it's a matter of embracing that technology, or at least have a sense of awareness about what it can and cannot do. And I think just like some of the other technologies that I've seen in my field, for instance, radio frequency ablation for arrhythmias in the cath lab, while you can still be a cardiologist not knowing how to do that, but you're just rendered less important because you don't know how to do that. So I think artificial intelligence is going to be the same way, that it's going to be there as a resource for anyone that understands it. And if you understand it, I think you would be more relevant in the future of medicine than if you're not aware of it.
Amen to that. So, minute left. Any parting thoughts on AI, machine learning as maybe a specialty, the future of healthcare?
Yes, I think just like some clinicians have an education and understanding of, let's say, quality improvement or safety or population health, I think data science and artificial intelligence will be a real discipline for some of the subspecialists to embrace. And again, my colleague and friend Spiro always reminds me that the AI Med conferences are not really about meeting every year or every few months around the world. It's more about creating this movement of validating this area and educating each other about data science and clinical medicine to make impact. And I think that's where the last few words are the most important, is this will make impact. It's just a matter of how we, go about this journey. But it's clear to me more than ever that this will make impact.
Fantastic. Well, Anthony, it's always such a great pleasure. So many great insights and, tremendous sort of leadership of taking the clinical community and helping them navigate through what is, a challenging new area, but an exciting area. And I'm with you. I think you sell it in the way that it is. It's an exciting area. So thank you for joining me on the show. I'm really grateful to you.
Thank you very much, Nick. I'm just a privileged facilitator, but thank you for the kind words as usual. And we look forward to seeing you again soon.
Likewise. So thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share it with me at Dr. Nick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, starting the revolution through evolution.